Hello, my name is Bailey Brown, and for my case study presentation, I am doing a case study on Klinefelter syndrome. Klinefelter syndrome is a numeric disorder of sex chromosomes in males. Klinefelter syndrome is a condition of testicular dysgenesis with one or more extra X chromosomes in addition to the normal XY pairing. Most males with Klinefelter syndrome have one extra X chromosome, giving them 47XXY, and in very rare cases, there may be more than one extra X chromosome, giving them 48XXXY. The presence of one or more extra X chromosomes happens when non-disjunction occurs during meiotic division of one of the parents. The extra X usually comes from the mother, but not always. There is no known cause for non-disjunction. One risk factor for this is advanced maternal age, but that only increases the risk slightly. Though having an extra chromosome is fairly common, the syndrome itself is not. Klinefelter syndrome occurs in approximately 1 in 1,000 newborn males. Clinical manifestations. Klinefelter syndrome is often not detected in babies, but there are a few common issues that infants and young children with Klinefelter syndrome sometimes have. Some signs in infants are a weaker muscle tone, delayed motor development, such as taking longer to walk or crawl, delays in speech, and testicles that haven't descended into the scrotum at birth. These children may have low energy levels, difficulty expressing their thoughts or feelings, and socializing. Some problems with learning may be present, especially in reading, writing, spelling, or math. As males with Klinefelter syndrome near and enter puberty, the more obvious signs of Klinefelter syndrome develop. They are often taller than average stature with abnormal body proportions, such as longer legs, a shorter torso, broader hips compared to other boys. They also often have delayed onset or incomplete puberty. After puberty, a child with Klinefelter syndrome will often have much less muscle mass, facial and body hair compared to other adolescents, as well as smaller testicles and a smaller penis. Enlarged breast tissue or gynecomastia. And males with Klinefelter syndrome have low or no sperm production, making infertility common in individuals with Klinefelter syndrome. Individuals with Klinefelter syndrome are at greater risk for anxiety, depression, as well as other social, emotional, and behavioral problems, infertility, osteoporosis, heart and blood vessel disease, breast cancer and other forms of cancer, other certain forms of cancer, that is, autoimmune disorders, and metabolic syndrome. For our case study, we meet a 10-year-old male with the initials of MC. He is brought to the pediatric clinic due to several concerns his mother has about his behavior lately. She describes that his teachers are concerned about him not focusing in class. She states that MC has always been very shy and quiet, but that his energy level has been low lately, and he's been showing little interest in things that he normally enjoys. She is concerned that he is depressed. She gives a history of him walking 5 to 6 months later than most children, and that he didn't begin to talk until he was nearly 4.5 years old. She says his teachers have always found him to be well behaved and cooperative. He had a lot of difficulty learning to read and write as well. She states his speech still does lag behind other children his age. She states he understands the conversations of his peers, but he doesn't use language the way that they do. On exam, the patient's height and weight are in the 95th percentile for a 10-year-old white male, and his penis and testicles are small for his age as well. And below are his laboratory results. For question 1, identify 4 significant abnormalities for which the parents may have sought medical attention for their child much sooner. His parents may have sought treatment sooner for his delayed motor skills, his delay and continued difficulty with speech, his difficulties with learning, with reading and writing, as well as his issues focusing in school, and lastly, his low energy levels and possible depression. Question 3. Identify 7 clinical manifestations from the physical exam and laboratory testing that are consistent with Klinefelter syndrome. When conducting a physical exam on MC, it is found that his height is 5 feet, placing him in the 95th percentile for boys his age. His penis and testicles are small for his age, and he has issues with speech. For his labs, he has high FSH and LH levels, with low testosterone. This indicates that his testicles are not functioning correctly, as testosterone is produced by the testes. Finally, his karyotype is XXY, all supporting a diagnosis of Klinefelter syndrome. Question 4. Does the patient have the most common form of Klinefelter syndrome, a non-mosaic form of the condition, or an extremely rare mosaic form? Non-mosaic Klinefelter syndrome is more common. This is when all of the person's cells have the same karyotype. In our patient's case, this is 47XXY. In some individuals, they have what is called mosaic Klinefelter syndrome, where the individual has 2 distinct karyotypes. Question 5. What is the probability that the patient will be able to have children? It is unlikely that the patient will be able to have children, but new technology can assist in making it a possibility. The family should be counseled on the potential possibility of cryopreservation of sperm, if any are found later on, as well as other infertility treatment methods that could be used later on. Treatment of infertility. Microdissection testicular sperm extraction. One treatment of infertility in these patients, or any condition with non-obstructive azoospermia, is microdissection testicular sperm extraction. Non-obstructive azoospermia is the absence of sperm in ejaculate not caused by an anatomical obstruction. Microdissection testicular sperm extraction is considered to be one of the best methods for surgical sperm retrieval among patients with non-obstructive azoospermia. Klinefelter syndrome is one of the most common causes of non-obstructive azoospermia. Microdissection testicular sperm extraction was developed in 1999 from the former testicular sperm extraction methods, but using a higher strength microscope. This advance in technology allowed for far greater success in retrieval of sperm. Now, microdissection testicular sperm extraction has been around for a number of years. They have been able to hone in the optimal conditions for the patient to be in prior to the procedure, making it all the more successful. The patients have a greater chance of success if they're receiving testosterone therapy at that time and to the point where their testosterone level is normal. Also, if their FSH and LH levels are minimal, and if they are young, but post-adolescence. Another study of microtesticular sperm extraction suggests that optimal years for retrieval are 16 to 30 years of age. Question 6. What is the function of follicle-stimulating hormone, or FSH, in males? Follicle-stimulating hormone is a part of the hypothalamic pituitary control system that initiates the production of sperm and testosterone by the testes. In normal onset of puberty, the hypothalamus will release gonadotropin-releasing hormone that then stimulates the release of FSH and LH by the anterior pituitary. LH stimulates the production of testosterone, while FSH stimulates the production of sperm. After testosterone levels are normal, this then inhibits the further release of FSH and LH. Laboratory abnormalities. So in the example of our patient, his LH and FSH levels are so high because his testicles cannot produce adequate testosterone to inhibit further release of those by his anterior pituitary. So here I've listed the appropriate levels of FSH, LH, and testosterone, and his are listed below in orange. As you can see, he had very low testosterone with high FSH and LH. Question 9. Would you suspect that this Klinefelter syndrome patient is a good candidate for immediate treatment with testosterone? Yes, he would be a good candidate for testosterone therapy. In a double-blind study conducted on 84 4 to 12-year-old males with Klinefelter syndrome, it found that low-dose synthetic testosterone therapy helped improve common issues with behavior, difficulty socializing, anxiety, and depression seen in patients with Klinefelter syndrome. The study also states that there have been retrospective studies on testosterone replacement therapy in infants with Klinefelter syndrome that later saw higher scores in intellectual, language, and neuromotor skills between 3 and 6 years of age. This study suggests that early hormone replacement can lead to alleviate some of the common developmental issues and social and emotional issues common with Klinefelter syndrome patients. The biggest problem with early detection and treatment of Klinefelter syndrome is that most often it isn't found until the child has failed to go through puberty. Testosterone therapy can help improve the symptoms of Klinefelter syndrome, an exception to infertility. In addition to treatment with testosterone, supportive therapies are also necessary. In our scenario, the examiner referred our patient for behavior, physical, speech, and mental health therapy. Depression, anxiety, and body image issues are common in individuals with Klinefelter syndrome. And these are my citations. Thank you so much for watching. Please send me any questions via our Moodle discussion board. Thank you again.